Hello everybody, my name's Chris Bartley and I'm a Senior Health and Safety Advisor for Stallard Kane. Over the past couple of weeks, I've started to go back out onto construction sites, carrying out audits and inspections, looking at general health and safety measures, but also with a focus on what COVID-19 measures are in place to reduce the transmission of the virus. So I thought it would be a good idea to carry out a COVID-19 in construction toolbox talk, which can be delivered via video to site operatives, supervisors, and even, senior management in principal contractors. This will allow you to create an awareness within your company to reduce the transmission of the virus. And what I wanted to cover is what we should be doing when traveling to and from work, what we should do when we arrive at site, what the canteen and eating facilities should look like and what we should do when on our breaks, and what measures we need to implement when we're actually working on site as well. Okay, so when traveling to site, you want to look at traveling alone if you can, using your own transport or works vehicle. Avoid public transport where possible, and if you have to share and travel with somebody else, minimize the number of people traveling together. Keep them in the same teams or partnerships, okay, to reduce the amount of people mixing when traveling to work. The vehicle should be cleaned on a regular basis, before work and before we start on our journeys, and at the end of the day when we've finished. And always wash your hands and use hand sanitizer when arriving at site. And when you get to site, you're obviously going to need to access site. A lot of the sites that I've been in have took away the turnstile entrances, or they've kept the turnstile entrances, but taken away the fingerprint, thumbprint access to reduce the amount of people touching touch points. As you can see in this picture, there's a one-way system, there's a hand sanitizer station, and there's also a lot of signage showing site operatives and site visitors what the COVID-19 rules are on that site. What you need to do is maintain social distancing when accessing and exiting the site. Do not gather at entrances. Wash your hands when you get to site, or if there's a hand sanitizer like in this picture, if there's a hand sanitizer station, use that hand sanitizer before entering site and when leaving the site as well. Make sure you adhere to any one-way systems in place and pay attention to site signage. Now, when you're actually going on your breaks, the canteen and eating facilities that are provided by the principal contractor or the people in control of site will need to be adapted so you can maintain that social distancing. As you can see from this picture, tables and chairs have been arranged to improve social distancing measures. They've even marked out the 2-meter distance on the floors using tape. There's signage to inform users of that canteen and eating facility of what they should be doing. And they do have enhanced cleaning procedures in there as well. So, things that you can do to reduce the transmission of virus while going on your break is staggering your break times, so you're not all going on breaks at once. Look at bringing pre-prepared food, so that means you're not using the microwave and touch points more regular. Maintain social distancing whilst in the eating facilities and whilst on your breaks. Sit at separate tables. Within this picture, it's only one person per table. And place any rubbish in bins provided, and clean the tables and other areas after use. I also went on a site where they provided seating and rest facilities outside, which is good in this last few months because we've had good weather whilst we've been in lockdown and these measures have been in place. Again, it was only one person per table, and that it was depicted in the signs at the side of the tables, as you can see in the picture. Now, when you're actually working on site, there are going to be measures that you also need to adhere to. In certain circumstances, and the majority of the time, you will be able to maintain those social distancing measures. So ensure that social distancing is maintained on site where possible. Where there's one-way systems, adhere to these one-way systems. Stagger your start times and your break times, so you're not all starting at once and you're not all going on your breaks at once. Speak to your supervisor and liaise with the principal contractor in regards to the coordination of the work, so we're not putting everybody in the same work area at once, and that would avoid congestion on site. And where there's no one-way systems, make way on one-way systems where there isn't any, so allow people to move about site and pass each other. Now, there are going to be instances where social distancing cannot be maintained. Now, what you need to do is speak to your supervisor, speak to the principal contractor, liaise with each other, and decide on whether certain activities that are within that 2 metre distance need to go ahead for the job or the site to operate. And if it is essential for that job to go ahead, keep the activity to as short a time as possible. Further increase your hand washing. Use back-to-back or side working if possible, and carry out those activities in fixed teams or partnerships to avoid mixing with other site workers or other employees that would be working within that 2 metre distance. And finally, not as a substitute, but more as a supplement to the more robust control measures, PPE may be used as an option, but this would be just face coverings or disposable gloves. Remember, if you're using PPE for your everyday activities to protect against non-COVID-19 risks, such as FFP3 masks for the protection against dust, fumes, you still need to use those. But in regards to COVID-19, just general face coverings or disposable gloves will be sufficient. Okay, also what we need to do is we need to look at increased personal hygiene. So you should wash your hands for 20 seconds using soap, water or hand sanitizer more regularly when you arrive at site and leave site, before you're eating and handling food. Now also avoid touching your eyes. Use tissues if you need to cough. And any waste, such as tissues that you've coughed in or any cleaning products, you must bin. And one of the sites that I went on had dedicated waste facilities and bin facilities and provided tissues in areas, prominent areas around site. Now, there also should be enhanced cleaning procedures on site as well. And you may be asked and need to clean down areas that you've touched or equipment that you've used after use and even before use. So enhanced cleaning procedures should include taps and washing facilities, toilets, door handles, push pads and handrails, lift and hoist controls. And if you're using machinery, such as machinery that may have to be shared, like still saws or forklift trucks or telehandlers on site, you must clean down machinery, equipment and controls before use and after use. And again, like I mentioned earlier, clean food preparation and eating areas. And a lot of the sites that I've worked on or been on and visited have been providing additional cleaning stations to allow site operatives to do their bit in helping clean the site and reduce transmission. Okay, so I hope that toolbox talk has been helpful and you can get a few tips from there to reduce the transmission. If you need further advice or if you've got any questions, please go to www.stallardkaneassociates.com or email us at admin@skaltd.co.uk. Thank you.